What if the key to a happier, healthy life isn't found in the bottom of a pill bottle? While the United States spends more than any other country on its health care, the World Health Organization ranks us 37th out of all of the other countries in our overall health outcomes. In today's video, we'll explore why that is, why we do so poorly as a nation for our health, but more importantly than that, we'll actually kind of look at the system and figure out like, okay, how can we focus more on prevention and more holistic model of health so that we're promoting health from the inside out. I'm Dr. Will, family wellness chiropractor, and we believe that when God put you together, He didn't make mistakes. You are designed to be healthy, and it's our passion to help families unlock that God-given healing potential. So if you ever felt like the system focuses too much on your symptoms and your prescriptions and not enough about you and what you can do to take better care of yourself, this video is for you. So I want to look at a few definitions and then really dive into some research and some statistics about where we're at, but then even more so, like really get into some nuts and bolts, like what we can do to take better care of ourselves. And it's more about mindset than actual practical application. I could give you, the top 3 or top 5 things that you have to do today, and that gets everybody's attention, but it doesn't help you a week from now when you've forgotten what that top 5 is. I want you to think differently about you and your health, and that's where we're going to get sustainable changes, and not only sustainable changes for you, but actually changing the trajectory of you and your family's health and your future. Like, it's one thing to like have a regimen that I do every single day for me, and it's another for my kids to watch me as I make choices throughout the day, and I talk through those choices and they start to understand why I make those choices. And now they have the framework in order to make better choices for themselves, right? So I think one of the major problems with healthcare in America these days is because we focus too much on the treatment of disease. I think that we have one of the best emergency and crisis treatment models of care in the world, right? We have some of the best doctors in the world when it comes to that. However, allopathic medicine only focuses on the treatment of diseases and the treatment of symptoms. It doesn't really focus a whole lot on the prevention. But according to the CDC, chronic disease in the United States costs us $3.8 trillion, capital T trillion dollars annually in direct medical costs and lost productivity. $3.8 trillion. That's a huge number. When we look at like the cost of treatment, like what it is that we're using, the CDC study said that 70% of doctors' visits in America resulted in a prescription being written. Now, there's a time and a place for all of that medication. And yet, 70% of the time, was the answer actually take a pill? 70% of the time was the answer, you have XYZ problem because you didn't have enough medication in your system? This is where I want you to start to think differently. That doesn't mean that there's not a time and a place. But we're waiting until the only answer is cover it up, treat it with a medication or a surgery, rather than preventing or promoting health so that maybe the problem doesn't get that bad or doesn't happen in the first place. In America, approximately 66% of the population takes at least one prescription medication. The CDC says that 50% of adults in America take at least one prescription medication on a daily basis. Half of the US adult population has a daily prescription medication. 25% of those take 4 or more medications on a daily basis. That's a lot. Nearly 20% of kids in America have a daily medication. We're waiting until problems show up and only covering up the symptoms. We're not actually addressing the root cause. And so how do we do that? Well, we have to actually change the way that we look at our health and health care. Think of it like this. If the house catches on fire, I need to call the firefighters, right? I need to call the fire department. I have to have people who are ready and able to put out the fire using whatever means necessary. And if that means they have to bust down my door to do so, then they got to bust down my door to do so. Does that make sense? However, I might not call the fire department to rebuild the house, to repair the water damage, to come in and finish, to paint the walls after they've been rebuilt, right? That's not the specialty of the fire department. That's where I have to bring in a contractor, someone like who can actually rebuild the place. But take it one step further. Now, accidents happen. But what would it look like if I had appropriate strategies in place and systems in place in my home to prevent that fire from happening ever in the first place, right? And so there's a time and a place for all of these things. We want to try to prevent as many fires as possible. Thank God we have the firefighters when the house is on fire. And thank God we have people whose specialty is rebuilding the house after the fire has already been put down and the damage has been stopped. And that's really how we should be thinking about this. Like the fire department is all about stopping the damage, preventing it from getting any worse. But we have to take a different approach to rebuild better health afterwards. And that's where a holistic or a vitalistic model of health and healthcare actually comes into play. We know that the body is more than just parts and pieces and systems. It's all interconnected. And what I eat in my gut actually affects my brain health. And what I do with my body affects, my every other piece of my health. And so we want to look at everything as a whole. So people who focus on nutrition, functional medicine, that's one of the fastest growing areas of specialty within the medical field. Chiropractic, herbal medicine, acupuncture, naturopathy, all of these are holistic ways of looking at the body from the inside out rather than the outside in, looking at the promotion of health, what makes the body healthy in the first place, getting that working better so that the body is healthy and strong as a result. The World Health Organization research shows that integrating holistic practices and lifestyle change can reduce the risk of chronic disease by up to 80%. That's a large portion, and it just comes from making small, sustainable choices on a daily basis. Research consistently shows that lifestyle interventions effectively prevent and even manage or reverse chronic diseases. CDC has several studies on this. They saw that regular physical activity reduces the risk of heart disease by at least 35%. They say that eating a balanced diet can cut the risk of type 2 diabetes by at least 50%. Now, we are going to have genes and genetics that play a role in all of this. But man, if I can eat a more balanced diet and the risk of diabetes is cut in half, whether or not my parents had it, that's entirely within my control, right? And so we know that making small sustainable changes to our lifestyle can make a positive impact on our overall health. Think of it like a car. You don't wait till the car breaks down in order to take better care of it. We don't wait until parts are only worn out to replace them and service them and rotate them. Like we make sure that we rotate our tires so that we don't get stranded on the side of the road. We know that we make sure that we change the oil on a regular basis so that the car doesn't blow up on my way to work in the morning. We want to take preventative, proactive measures so that we experience in health and longevity and prevent a whole lot of the problems that we might experience otherwise. So remember that there's a time and a place for the miracle of modern medicine. And like there's going to be situations in which we have to take advantage of those more invasive measures. But way more of your health is in your control than most of us believe. It's not just enough to feel good. We have to function good. Not great English, but it's not just enough to feel good. Like we actually have to function well. We have to look for and develop and build health. It's not just enough to wait until we feel a problem. Let's try to prevent them in the first place. And it takes small changes. What I do today doesn't just affect me today and tomorrow. What I do today, I'm modeling for my kids. I'm modeling for the people who are around me. They see the choices that you and I make. And they see the benefits that you and I get. Like, what's one thing that you're going to do? What's one thing that you're going to look at differently, or what's one thing that you're going to choose differently just this week? Comment below, let everyone else know what your challenge is going to be. And if you're curious about what I mean by like health today and tomorrow and decades down the road, check out this video over here. I break down that concept a little bit more about how our body heals from the inside out.